Alright, so I'll give an example of a doctor who used a name other than the name that appeared on his medical license that was involved in my situation. And this is Dr. Ronald Wayne Helms Jr. And this is how his name appears on his medical license. Helms Ronald Wayne Jr. And this is with the Alabama Board of Medical Examiners and Medical Licensure Commission. So yeah, in Alabama, apparently doctors can go by names other than the name that appears on their medical license. And I think that this is something that every medical patient who goes to a doctor in the state of Alabama, you need to be aware of this. The people that are involved in the passing of the laws in the state of Alabama, they need to get to work on making this the law in Alabama as well. Ronald Helms is the CEO and the head doctor of Northside Medical Associates. I found that this practice, every time I saw this name of this practice written down in paper or in signage, the title of this medical practice, it was written differently, and that's a major red flag. And what's more, in 2020, this medical practice, this was sold and it was acquired by Complete Health, and this is a unit of Pharaoh's Capital Group. If you go and you look up the name of this doctor, his profile appears on the Complete Health website, and it says Ronald Helms, MD, and then below that it says Dr. Rock Helms. Alright, so he goes by the name Rock. Alright, and that's not his name, and it's not his nickname either, because this is not bracketed in quotations, and this is not the name that appears on his medical license. So one thing as a patient you should observe here is Complete Health, unit of Pharaoh's Capital. They own many medical practices across the United States. They're apparently okay with the fact that their doctors go by different names, and that's interesting. And I contacted him in 2019 because I went to one of his practices in Trussville, Alabama. And so this practice, this has been renamed to Complete Health, formerly Northside Medical Associates. And I saw two nurses there, Celeste Richardson and James Frankie Crum. And I had some major problems there, and I'll explain these in detail. I had this injury. I was dying basically, and I went there and I found that I did not receive adequate medical treatment. I left a message on Dr. Ronald Helms' answering machine. This is another thing. When you call his office, he don't answer his phone. And I spoke to a secretary as well. I never received a call back from Dr. Ronald Helms, who is the owner of Northside Medical Associates. So in 2018, I believe I broke the underside of my skull. This was a basilar skull injury, and a pebble-sized piece of bone broke off the underside of my skull. I had CSF fluid. That's the fluid inside your skull between your brain and the bone. This leaked out of this hole into a wound in my upper neck beneath my skull. And I went around to many hospitals and doctors to try to get this thing diagnosed and treated. I had very little luck. Now, I believe I may have been a victim of patient dumping. And in the hospitals, this is a violation of EMTALA. This is United States federal law, and this says that if you're a patient, you go into a hospital in the United States of America, the hospital is obligated to treat you based on your injuries. My experience is the hospitals would regularly misdiagnose me to circumvent complying with this law. And this is an extremely common practice, but it's illegal nonetheless. I didn't have insurance or job, an ability to pay, and I think this had something to do with how I was treated. So I got to Northside Medical Associates, and I was referred to this MRI. So on August 15th, I went into this facility, and I had the scan done. There's a reception waiting area. You fill out some paperwork. You go back into the back. They have a couple different MRI machines in there. The woman who ran the machine and attended to me, this is Lindsay Jones. And her name appears several times in the records I got from this place later on. And yeah, I've been in several MRI machines. I'll just mention this. The technicians who work the MRI machines, if you do this for a job, if you employ people to do this for your medical practice, you need to hire people who are more attentive to the needs of the injured who are having the scans done. Because this woman, Lindsay Jones, she did not take into consideration my comfort to a very large degree. If you're going to have a scan done in these machines, like a head scan or something, you may have a very serious injury of your head. And I found, I had to lay back in this thing, very uncomfortable. My head laid lower than the flat plane of the rest of my body. And this is extremely uncomfortable, especially if you take into account the injury that I had. Okay? And when I brought up, I asked them if I could have some kind of a pillow, head cushion, or whatever. She acted like she could care less. Just very pushy, trying to get the scan done, and could care less about my concerns. What it looks like is they have a set way that they do things, and if you need some type of accommodations that go outside of those set parameters, they're not really set up to help you out that much. And this is very unfortunate, especially when you consider the amount of money that's involved in these things. So Lindsay Jones, all right, now she asked me about my condition, and she wrote down here with a pen and with her hand what I told her, all right, and she signed off on this. So I'm going to present this because later on I got my records from Northside Medical Associates, Complete Health, now owned by Pharaoh's Capital. In my records, they appeared edited. And so I'll put this up here because this is significant. All right, GFR value, right side. I have no idea what that means. My injury is on my left side of my head. Technologist comments, pain severe, right side of neck. And that's not what I told her. My injury's on my left side of my head. Alright, this is significant. Base of skull. Alright, that's my injury. Yeah, other places they wouldn't even acknowledge this. St. Vincent's East Hospital, for example. And then she writes here, feels like head will fall off. Left arm, limp, and numbness. Okay, so she says left arm. My injury is also on my left side. Twisted neck last year. Can't turn head. Left or right. So you can see here she signed. It says MRI technologist Lindsay Jones, RT. St. Vincent's Trustful. And on the letterhead of one of these records, there's yet another address, there's yet another title associated to a business in this 7201 Happy Hollow Road facility. And I found that almost every time that I saw a business or a medical practice or something to do with a doctor or a nurse, every time the title of the business was written down in this place, it was a different title. They changed the words around, add words, subtract words. Very strange. Almost every time the title of something that operates inside this building is written down in signage or on a piece of paper or in a bill, it's different. And why is this? So on the top of here, there's yet another title. Okay, Northside STV Primary Care East LLC, Trustville, 7201 Happy Hollow Road, 35173. So here's the referral, the imaging order. James Franklin Crum, NP. And then below this it says Trustville Primary. So there's yet another title for something that operates in this building. Yeah, I received a call shortly after this scan, and I was told that the MRI that I had done, the results came back as negative or normal. So there was no injury that appeared in these MRI images. That's what I was told was the official reading diagnosis. And Frankie Crummy writes here in his record, recent MRI negative. So, I'm sitting there. I'd just been charged $500 for this MRI scan in August 2019. I had to lay in this machine for 20 minutes, very uncomfortable, and I injured myself in the process of doing this. The injury that I had, this was exacerbated. It was made worse by laying in this uncomfortable position. I knew that this injury was a lot more serious than they told me, and I went back and got my records. And here's what I found. The doctor, the radiologist who looked at these pictures, his name is Michael Brant Ruff, MD, and he's a very experienced radiologist that works for St. Vincent's Hospital Ascension, Birmingham, Alabama. You can see here on this record, it also says copy to Jones Lindsay. Alright, so that's the MRI technician. And it says they did a MRI cervical spine exam. And they should have been looking for things in the soft tissue of my neck, and there's some really major things that show up there. The main injury that's visible, it's outside of my skull at this point. Beneath my skull, the main evidence of this injury. It's technically in the upper area of my neck. But Michael Brant Ruff, here's his impression. The MRI of the cervical spine is essentially unremarkable without disc protrusion or significant stenosis. And you can read the rest of this, and basically he is saying that he notes there's no injury here. And this is not true. This is misdiagnosed. And the evidence, it's very obvious in the images. Okay? So you have to ignore this erroneous radiologist report. And, it's just very sad. This guy, Michael Brant Ruff, very experienced, very well paid. Guy's a multimillionaire. And he should be able to see this very easily, but he didn't. Alright, so here are the pictures. Alright, this was the main cause for my pain, and this was the main manifestation of this injury at this point. Alright, and this is directly below my skull that was broken. You can see there's massive infection. The infection, it went out into the left side of my head in the jaw area. And Frankie Crum later, he acknowledged this as mastoiditis. But yeah, it's interesting, something like mastoiditis, this doesn't just appear out of nowhere. So what caused this? And they didn't seem that interested in finding out what causes. All they have to do is look at these pictures and they can see what happened to me. But yeah, I had problems with this as well. So you can see here there's some type of anomaly. It's like a black sphere. And I believe that I had parasites that grew in this area as well at this time. Yeah, and so this injury, yeah, in total it's about 3 or 4 inches diameter. All right, so this is a very obvious injury.